So here we are with part 2 of the examination. We're going to be assessing your nose, your mouth, and your throat. So I'm going to start with your nose. I'm just kind of inspecting your nasal area, just making sure that the color is consistent, that there's no deformities, there's no abnormalities. The color is even with the rest of the face, so that's great there. I'm also going to just test your patency. So I'm going to ask you to hold one nostril, take a nice deep sniff in, okay, and the other one. Cool. Any problems there?
No, not at all.
Feels clear? Okay, great. And I don't have a speculum, but which if I had, I could inspect the internal part of your nose there, and really we'd be looking at your septum, making sure there was no deviation, no abnormalities there. You know that the color, the integrity, everything was intact. So, but I do have my little pen light, so I'm going to just take a little peek here and see what I could see. At this point, I would have gloves on to be checking your nose here if we were in the office. So I'm just taking a peek, and everything looks intact there. Okay, and I'm just going to palpate the external nose, and just let me know if it feels any tenderness or soreness. No. Okay, great. I'm going to assess your sinuses. So I'm just going to apply some pressure here. Any problems with that?
No.
Tenderness? Okay. I'm just going to palpate the sinus areas. Any problems or pain? No. Okay. Ever get any kind of sinus headaches or anything like that?
No.
Great. Okay. So now I'm going to check cranial nerve 1, which is your sense of smell.
Okay.
So I'm going to have you close your eyes.
Okay.
Okay. And I am going to ask you to close off, hold one nostril. And then can you tell me if you smell anything?
Orange.
Perfect. Okay. And keeping your eyes closed. Let's do that again with another scent.
Garlic.
Great. Okay. So cranial nerve 1 is intact. So that's great. The next thing I'm going to do is be looking at your mouth. So I would have changed out my gloves to be looking in your mouth. So I'm going to just grab my pen light here, and the first thing I'm going to be doing is just inspecting your lips, your teeth, your gums, just making sure that everything looks normal, making sure on the outside of your lips there's no sores or anything like that. Can you open up your mouth? I'm just noting your teeth, noticing that you don't have any dental decay. Can you stick out your tongue for me and say ah? Okay, noticing that you don't have any tonsils there. Looks like your uvula is centered and is going up and down as it's supposed to. Just going to have you look again in there. Just looking at the sides of your cheeks, making sure everything looks fine. It would also be palpating your tongue with a tongue depressor. Looking around, everything looks good. I would also be just get some cotton and kind of moving your tongue side to side, making sure that there's no abnormalities there. And that also does test cranial nerve 12 as well, just looking at the strength of your tongue and the movement and so forth. So everything looks okay. All right, and I am going to move on to your throat to finish up the rest of your neck and your other cranial nerves that we haven't touched. So I'm going to just kind of feel along your neck. I'm looking again, inspecting it, making sure it's symmetrical, making sure there's no abnormalities, no masses, no lesions or anything like that. Just palpating along. Is anything sore or tender to touch?
Nope.
Okay, I want to test your range of motion. Can you put your chin to your shoulder here? Perfect. Repeat on the other side. How about, can you get your ear down to that shoulder? Perfect. How about the other one? All right. So your range of motion is nice and controlled. Next, I'm going to be looking at your lymph nodes. You have 9 of them. So I'm going to start here down in the back of the base of your skull with your occipitals, going behind to your postauricular, your preauricular, the parotid, going down the neck to the cervical anterior and the posterior cervical, the mandible, as well as the submental and the subclavicular nodes. So perfect. All right. Any tenderness or pain when I touch?
No.
Great. And next I'm going to move on and just kind of finish up the cranial nerves. The next one is cranial nerve 5, which tests your, it's called the trigeminal. So I'm going to have you shrug up your shoulders if you want to. Actually, I apologize. Cranial nerve 5 doesn't test that. It tests your ability to tell heat and cold and blunt and sharp objects. Okay, so let me just have your fingers hand for a minute. So this is dull and this is sharp, okay? And before we get started, I have a little cotton here. I'm gonna have you close your eyes. Just gonna touch different places on your face, and can you just let me know if you do feel them and where you feel it?
Cheek left. Cheek right. Under my lip. On my nose. Forehead. Forehead again.
Okay, great. And again, the blunt and the sharp, so I'm gonna just be touching some places here, and if you can let me know whether it's blunt or sharp, okay?
Sharp.
That's great.
Sharp. Soft. Soft. Sharp. Sharp.
Okay. And we would do that same thing with heat and cold as well, just to make sure that you could tell the difference there as well. Okay, great. Next thing we're going to be doing is assessing cranial nerve 7. So I'm going to ask you if you can smile for me. Smile without your teeth. Then smile, let me see your teeth. Can you frown? Can you puff out your cheeks? I'm just going to feel and make sure that you can't expel any air. Okay, close your eyes really, really tight. And then I'm going to try to force them open. Don't let me. Great, okay. And then we're going to move on to cranial nerve 11, which is testing your trapezius muscle, which is what I was going to do earlier. If you shrug up your shoulders, and then I'm going to try to push them down. Don't let me. Excellent. Okay, you can relax there. And then I'm going to be testing your sternoclavicular. I never say this word right. Sternoclaviculomastoid. So I'm going to just push against you, and then you're going to turn your head that way and try to push against me here. Excellent. I'm going to do it again on this side. And can you push against me? Great. Okay. Going to check the time here, making sure we're okay for time. Perfect. All right. So if you want to scooch on back, we're going to move on to the listening to your lungs. And for this part of the exam, I'm actually going to have you sit in the chair just so that the camera can see it better.
Okay.
Looking this time at the thorax and the lungs. So I had you take your shirt off. We're just sitting in this chair. It's just better positioning. And I'm just inspecting the anterior chest, and then I'm going to go around to the back to the posterior. I'm just looking for symmetry, checking out the rate of your breathing, making sure you're not using any accessory muscles. Also noting again the skin, that there's no abnormalities there found. Gonna just kind of come around to the back and do the same thing, taking note that of your spine, looking at your scapula, all that appears to be good. While I'm here in the back, I'm gonna just be palpating the posterior chest. Just gonna be feeling down your back here, just checking for any signs of crepitus. Okay, great. And now I'm going to be testing for tactile fremitus. So I'm just going to put my hands here, and then when you feel my hands be put down, if you could just say 99. Okay.
99. 99. 99.
Okay, great. And while I'm back here too, I'm going to just be percussing your posterior chest and just really assessing to make sure that there's no, tenderness or abnormalities or there. Feel. And also I'm just going to be, if you can kind of lean forward a little bit, I'm just going to be checking here. Can you take a nice deep breath in and out for me? Good. And my hands go with you, so that's great. And I could do the same thing to the front as well, checking for crepitus and tactile fremitus too. So that's good. So now I am going to, the one other thing that I would do back here is be determining the diaphragmatic excursion. Essentially would be mapping out here in the back, inspiratory and your expiratory breathing. If I had a pen, I would kind of just jot it down here to check, to compare that as well. And then I'm going to auscultate. I'm going to listen to the anterior chest, and I'm just going to be listening for any adventitious sounds, which are any abnormal sounds like wheezing, crackles, rails, that sort of thing. So when I put my stethoscope on, I'm just going to have you take a nice deep breath. I'm also going to listen to your back too. Okay. Good. And I'm listening for stipular sounds, and everything sounds perfect, so that's great. The next thing I'm going to be doing is assessing for your voice. It's called assessing voice sounds. So again, I'm going to be doing this on your posterior back here, and I'm going to put my stethoscope on your back, and when you feel it, I want you to say 99, okay?
99, 99, 99, 99, 99, 99.
Great. And it sounds muffled and distinct like it's supposed to, so that's great. So the next thing we're going to be testing is whispered pectrilogy. So when I put my stethoscope down, Rob, I want you to whisper. You can either say whisper 99 or 1, 2, 3. So if you want to just whisper 1, 2, 3 when you feel me put the stethoscope down, okay?
1, 2, 3.
I'm sorry, whisper.
1, 2, 3. 1, 2, 3.
Okay, great. I don't hear anything with my stethoscope, which is a normal sound, but I know you were saying it because I could see your mouth moving. And so the last thing we're going to check is equorphony. So when I put my stethoscope down here, I just want you to say the letter E every time you feel me place it.
E, 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 E.
Okay, great. All right. So we're going to move on next to the breast and the lymphatic system. So do you do any self-breast exams at home?
No.
Okay. I'm just going to push back so they can see me on the camera as well. Okay. So for men, I know that people think it's just a woman's get breast cancer, but men can as well. So typically for a man, it's not like a woman where you have to do it after you've had your menstruation. You can pick any day of the month that you wanted to do it, and you would start by feeling underneath your armpit for any kind of abnormalities, any kind of bumps, paying attention to anything that feels tender. Then you would go ahead and in small circles go around kind of the chest, breast, as well as just be trying to express the nipples to make sure that nothing comes out as well. Okay, and to do that, you would be laying down. And for a male, it's great when you're on your back if you kind of put a pillow underneath a little bit just to get your breast tissue up a little bit higher with your arm over your head. So if you were doing your right breast, you would have the arm up, with the pillow underneath, and be using your left hand to assess, and then again to the other side.
Okay.
Okay, good.